So in this presentation, we're going to be focusing on mental health disorders, and more specifically, how mental health is across various environments and the different cultural factors affecting how we perceive mental health and how it's perceived by various subgroups. So the first thing I want to look at is mental health in the media. Unfortunately, there's a negative stigma that comes with mental illness, and the media is fairly guilty in helping to create that negative stigma. There was a qualitative study done in 2016. Now, this study focused on how media portrays mental illness. And so they took hundreds of news articles between the years of 1995 to 2014 and just kind of broke down what these media articles were talking about and how it related to mental illness. So in that study, they found that an overwhelming majority of the articles that were written were really negative towards mental health, and that they actually focused a lot on violence. And so of all the stories that were looked at, 55% related mental health to violence. And then those can be broken down into self-violence and interpersonal violence, but still violence nonetheless. And then there was a small 14% that looked at success and treatment for mental health and just positive outcomes. So if we look at the difference of how the media portrays mental health, there's a stark difference. They talk pretty frequently on the negative outcomes of mental health and very small on the positive. And so this, unfortunately, helps to create that negative stigma and fear that mental health is unjustly associated with violence. And so it kind of creates this unjust connection between the two. And another aspect is family support. And so good family support is essential and is often a cornerstone of recovery for people with mental illness. And so many who have recovered from serious mental illness or suffer from just mental illness in general have reported that family support was a greater help to them than the treatments and medical professionals that have helped them through. So it can have huge effects and really help pull people through. The support that people will require who suffer from mental illness varies greatly. And so there are a variety of mental illnesses. And so in this presentation, we're kind of clumping it all together, but it doesn't really give it fair justice because the various disorders affect people differently, and individuals react to those illnesses differently. And so, for example, somebody with PTSD or depression, anxiety, these patients tend to distance themselves from society and often loved ones. Whereas, something like ADHD or autism, both categorized under mental illness, are very different. And these are often diagnosed in young people, children often, and they require their family. They're still needing that support from their loved ones. But for families, just as mental illness can have huge, tremendous effects, both emotionally and financially, it does the same to families. And so it can be very hard for families to be that support. And then there's also the role of peers. And so with the role of peers, this is something that as communication and the methods that we communicate grows, so does the role of peers, because oftentimes the way that peers communicate evolves with the communications. So in recent years, there has been a trend of support groups and just peer support through internet access. And so there's a lot of online forums that people can go to receive support from others. There's a bunch of different messaging apps as well as Zoom and Skype that a lot of these groups have been formed to support. And then there are still in-person therapies at the moment, not so much because of social distancing and the impact that has had. But I would say probably about a month ago, 2 months ago, that this was a fairly regular thing. And then this type of support has shown to reduce symptoms of hospitalization, increases social support and participation in the community, decrease length of hospital stays, and then just improve well-being and self-worth, self-esteem, and the ability that people have to function in society.
People with mental disorders are vulnerable in a number of ways. There's a huge stigma in our culture, of course, and because mental disorders are an invisible disease, sometimes people don't think that help or support is needed because it's not something you can see, which also makes it difficult to qualify for extra services that may be needed. For various reasons, many with mental disorders have a difficult time advocating for themselves and tend toward isolation. Part of not advocating for themselves is a self-care deficit, and that includes both obvious types of self-care issues, like someone who's depressed and doesn't shower for several days, and the not as obvious self-care issues, like someone with ADHD forgetting to make or keep doctor's appointments. All these issues, along with communication problems, perception problems, and employment problems, culminate in greater risk of being victimized. Vulnerability of this population can be cyclical. Many mental disorders have a genetic component, so the vulnerability would be passed down generationally that way. Another way that vulnerability would spread is caregiver stress and fatigue, which can be felt by those being cared for and may increase anxiety and exacerbate mental health symptoms, which in turn stresses out the caregiver even more, creating a cycle. People with mental disorders may have difficulty adapting to change, which just makes their vulnerability continue, and they may struggle with healthy coping mechanisms and negative beliefs about their prognosis, which they can pass down to their children through example or through teaching them. Currently, there are a lot of really great resources that are backed by state and federal governments that are very helpful for people suffering from mental disorders. There have been some very helpful laws passed, like the federal parity law and Medicaid expansion, that have greatly increased people's access to mental health care, especially those with lower socioeconomic status. However, the cost for most treatment is still too high. I have a son with autism, and I take him to his behavioral specialist once a week. Thankfully, it's covered by my private insurance, but if it wasn't, it would cost $200 a week for that. Most people simply can't afford to pay $800 a month on top of all their regular living expenses. Plus, for some reason, 45% of psychiatrists don't participate in any insurance plans at all. That's a huge issue because there's already a shortage of providers in the US. There are several barriers that exist within a larger community that make people with mental health disorders more vulnerable. A couple of slides back, I talked about the problem of how cultural stigma and mental disorders are largely invisible, but I'd also like to add that in our culture, mental health doesn't seem to be as valued as physical health. In the last slide, I talked about the limited access and coverage of providers as well as the cost, and these are also huge barriers. Many religions teach of a punishing God or that sins cause feelings that may actually be signs and symptoms of mental disorders. This becomes an even bigger problem when confession of sins doesn't end up giving any relief of symptoms. And as far as gender goes, men are less likely to seek mental health care than women, and older men are less likely to seek help than younger men, probably due to generational attitudes about what masculinity means. There are parts of the world and certain cultures where people with mental health disorders are more in danger than other parts. Some of that danger comes from those around them, and some of it comes from depressing statistics. For example, suicide rates are highest for Native American men. Immigrants and minorities in any region are less likely to seek mental health care. African Americans and people of Latin descent are less likely to trust healthcare providers. Hispanic Americans and Asian cultures are more likely to view people with mental health disorders as dangerous. Asian cultures also believe that mental illness reflects poorly on the family. The idea of yin and yang in China and karma in India makes mental health out to be a thing that someone may deserve, or that cannot be changed because it makes the balance.
So we're looking at health disparities and the socioeconomic status of those with cognitive disorders. Again, that's including your ADHD, autism, PTSD, and anxiety and depression population. And in research, it has shown that those who live in low-income areas with lesser water and air quality and high violence areas, it is shown to increase mental health issues. So those people in that lower socioeconomic areas, their health is lesser than those living in a more higher socioeconomic income, higher level. And then individuals who have a low income or even unemployed and have limited education increases their chances of developing negative mental health and cognitive issues. And those who live alone and not living with a partner or room increases the risk for mental health issues. Health disparities between race and ethnicity. Racial discrimination is an issue, and those dealing with cognitive deficits can be neglected from care and support depending on where they live and what race they are. Studies also show that those who travel to different countries, for example, those who immigrate from Mexico to the United States, do not usually seek help due to being an illegal immigrant or somebody not of that country, in fear of being deported back to their country. So yes, race and ethnicity, there are health issues, probably between all types of populations, but especially those dealing with cognitive issues. They tend to try to fix it on their own because they fear what could happen to them if they seek help. And also health disparities within religion. Lots of studies have shown pros and cons with religion and those who deal with anxiety, depression, PTSD, and autism, ADHD. The pros show that religion provides a great support and a bright outlook to their life and future. It gives them something to believe and work for. It also is, like it says, a great support. You're able to gain a community within that religion to help support you in that cognitive deficit, that population can seek help, and those around them can wrap their arms around them and love them and help them. Some cons that were shown in some studies were that individuals might be shamed if they weren't able to live within the laws of that religion, if that religion required them to live a certain way and they couldn't, that they were shamed. That would allow for those individuals to fall deeper into a negative mental health state. So again, pros and cons with religion. Gender plays a big part in how both genders are looked at and how each one seeks help with cognitive deficits. Males typically tend to not seek help and try to fix or ignore what they might be going through. Studies show women are more willing to talk and seek treatment than men when it comes to cognitive deficits. And for both genders, a big problem is just the stereotype of that, anxiety, depression, kind of these hidden diseases within people, ADHD, PTSD, and autism. These things people a lot of times see as a non-issue, or they're having a bad day, or they're not a well-mannered individual. That stereotype is a problem between both genders that is an issue and hopefully can be resolved within the years to come. But yeah, both genders have to face that.
Okay, so some health disparities. Geographical location can be something that could be a barrier to overcome for people with mental illness. Some things I thought of, specifically in Utah, somebody that might have anxiety to go outside, or say maybe it might snow in Utah a lot, or other parts of the country where it does snow. It might be hard for somebody with anxiety to get out and go to certain their counseling sessions or checkups or doctor's appointments or anything like that to help get that care that they need. Other locations that I thought of as well could be like rural areas, like in Utah or the South, where somebody might live. The mountains live kind of on a farm far away from their doctor's office. It might be hard for them to drive, a couple times a week to get to the doctor's office that often. And so location can play a big role when it comes to getting that mental health care that they need. So telehealth for sure can play a beneficial role in that. Instead of that anxious person leaving the house during a snowstorm or thunderstorm or anything, they can just have that counseling session via web, via telehealth. So that way, these people can get the care that they need, that they don't have any breaks in their counseling sessions, and can continue to get that and continue to get better. And without having to go through that experience or anything like that. So definitely a great help. Study I read that said those with PTSD specifically there wasn't any difference between a telehealth session and a in-person session. It was just beneficial for them to not have to leave the house in certain settings, basically. So telehealth can play a very important role for those with mental illness. Biases is another health disparity, especially I think for mental health. Bias can be one of the bigger barriers to overcome. I like this quote in a journal I was reading. It said, in American society, there's a distinction made between somatic illness and mental illness, which is rooted in the misperception that symptoms of mental illness are a result of having a weak character or making a perverse choice. And I see that sometimes in the hospital where we have, people with mental illness come in, and whether that's an addiction or anything else. And I can see that they're treated differently. People have their own thoughts on mental illness, their own biases and everything, and they can be treated differently. And it's definitely real. It's a real thing that happens. And due to that stigma, like we kind of went over before, males are less likely to reach out for help just because they don't want to be seen, stigmatized and have people look down on them because of those biases. So that's something the healthcare community can work on, is to cut down on any bias toward anybody. And that we just need to give the same care and treatment to everybody that comes in, no matter who they are, why they are there. And if we can cut down on that stigma, I think more people would be more likely to actually reach out for help and know that they're going to get good care as opposed to being judged and that kind of thing. So looking at health disparities across the world, it's, it kind of depends where you live, where you're going to get good healthcare as opposed to not so great. That's a cool survey that I read. Surveyed people all over the world, and they found that in developed countries, 7 to 8% of people are likely to associate mental illness with someone being violent, and compare that to a developing country, 16% of people associate violence with mental illness. So it just kind of goes to show, in different parts of the world, in either developing or undeveloped countries, there might be more, developing countries specifically, there might be more of a bias toward mental illness, and that could be just because, they're still developing their healthcare. They're developing, they might be worried about clean water and getting food and everything, as opposed to having developed a better mental health healthcare system, basically. So here in the United States, there's programs, different systems, legislatures in place that are specifically to help those with mental health. PTSD, there's Veterans Affairs and different programs to help veterans overcome PTSD. CHAD, the children and adults with ADHDs, they're in place to kind of help those with ADHD. Yeah, and so that's great in the United States and other developed countries that have those programs. But another country that hasn't quite developed that yet, those with mental health could suffer without those programs, and the stigma of mental health probably isn't realized yet. We kind of went over before, different parts of the world have different types of family units, different cultures, and that can all play a part in disparities, barriers to overcome that mental health illnesses and everything. So that's it, and then here's our references.
So these are all of our references. I hope you enjoyed this presentation and learned something that can benefit you and help you understand a little bit more about mental illness. Okay, thanks.